I'm Dr.P.V.Ramarao, Chief of Children's Services and Director at Andhra Hospital, Vijayawada. I'll talk about coronavirus in children. Corona can present in children, but in children usually presents with mild symptoms when compared to adults. In children, it presents with a bit of a cold and mild dry cough and low-grade fever. And in some children, it could be like asymptomatic as well. They would be like asymptomatic carriers. In about 50% of the children, it just presents with the mild symptoms. In about 30 to 40% of the children, it can present with severe symptoms. You've been seeing in different parts of India and also elsewhere in the world, corona can affect children. And you've seen one child in Hyderabad, 3-year-old child presented with corona, and a few in Karnataka and in different places. And it can also affect newborns. Whenever the child presents with mild symptoms, during this period, don't need to bring the child to the hospital. Call telemedicine services. We all started in telemedicine services. You could call them. You could get in touch with a pediatrician and take their advice and then manage those children at home. On the other hand, if the child presents with severe symptoms like high-grade fever and cough and breathlessness, that is difficult in breathing, of course you need to contact the pediatrician through telephone first and then come to the hospital and then get him assessed. The problem with this is the virus usually presents with mild symptoms in children, but they could transmit the virus to adults. So when the adults get affected, in some of the adults it could flare up and then present with severe symptoms. So when you manage those children at home, if it's a bigger child, you could advise to stay apart and try to maintain that social distancing of 3 feet with other children, and then ask them to hand wash properly. I know that almost all the children, they are staying home only, and you could spend time with the children, and you could engage them in other household works like some kitchen work, and they could help in cooking and they could help in gardening. And then you could also play with them. And then children with long-term and severe problems, for example, preterm babies, or children with long-standing lung problems, chronic lung disease due to different causes, or children who are immunodeficient due to different underlying problems, or children who have cancer on different drugs, and or children on drugs like steroids and other chemotherapy drugs. They are vulnerable to corona during this season. So be careful, take extra precautions if you have the child with problems, and manage them accordingly. If they are unwell, of course you know what to do. You could contact the doctor and get his advice. So if you follow these precautions at home, I think you could definitely control the spread of corona in children and from children to adults. We all stay united by staying apart. Protect yourself first and protect your children and families and protect your country.